This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Reatix Combi Kit is an essential medication used in the management of HIV infection. It combines 4 effective antiretroviral agents to help control the virus. Indications and uses. This medication is indicated for the management of HIV infection, helping to prevent the progression of the virus and maintain immune function. It is designed to reduce the viral load in the body and support the immune system's ability to fight infections. Patients may benefit from improved health outcomes when adhering to the prescribed treatment plan. How it works. Reatix Combi Kit functions by inhibiting the replication of HIV through various mechanisms involving its active ingredients, which block essential enzymes required for viral reproduction. Directions for use. Take this medication as advised by your physician, swallowing it whole with a glass of water. Do not crush or chew the tablets, and adhere to the prescribed dosage and duration based on specific factors such as age, body weight, and overall health condition. Regular follow-up appointments may be necessary to monitor your progress and adjust the treatment if needed. Possible side effects. Common side effects may include nausea, diarrhea, headache, and fatigue. Severe side effects require immediate medical attention if they occur, including any signs of allergic reactions or significant changes in health status. Precautions and warnings. It is crucial to inform your physician of any existing health conditions, such as liver or kidney disease, before starting treatment. Pregnant or breastfeeding women should only use this medication under medical supervision. Avoid alcohol during treatment, as it can exacerbate side effects and lead to serious complications. FAQs. 1. Can I develop a rash while taking this medication? Yes, skin rashes are a common side effect and should be reported to a physician. 2. Can I drink alcohol? It is advised to avoid alcohol due to the risk of bone problems. 3. How does this medication manage HIV infection? It reduces the viral load and improves CD4 cell counts, enhancing immune response. 4. Can it be taken during pregnancy? Only if deemed necessary by a physician. 5. What if I miss a dose? Take it as soon as you remember unless it is close to the next dose. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your health is important, and staying informed is key.